Thank you for joining us, and happy Valentine's Day to you.
Bless you. Thank you, and you.
Let's begin, if we can, with that letter from the COVID recovery group of 63 Tory MPs. It calls for a number of things. Can I ask for the government's thoughts on them? First, will all pupils go back to school at the same time in every school on March the 8th, as the CRG are demanding?
So, look, first of all, we share that restlessness to get things moving. Of course, we've got to be able to do so safely and securely, which is why we look on target to hit the target for tomorrow for vaccine. The first dose has been offered to the first 15 million, the first 4 top priority cohorts. And based on that evidence, which we'll then be able to set out on the 22nd of February, we'll be able to chart the course ahead. You're absolutely right. The first priority is to get schools back. The plan is the 8th of March. That's what we're gearing up towards. I think in terms of your question, is it all going back at exactly the same time? The PM will set out the details of that based on the evidence on the 22nd. And of course, we'd love to commit to as much certainty and set out the plans further in advance. But the challenge is, because we're still getting the data back on the impact of the vaccine, what it's doing to the virus, I don't think we responsibly can do that. We have to be evidence-led. But the PM's going to set the path forwards, set that out on the 22nd of February. So that's a week Monday.
Understood. It has so far been the government's plan, policy, philosophy to approach all this cautiously. That's the word the Prime Minister used yesterday, caution. So it would seem a little odd if you piled all the kids back in as a oneer, and perhaps we might see primaries come back before secondaries, for example.
I think what the PM said over the weekend was he was optimistic but cautious with it, and I think that's right. We can look at the data on the vaccine, both the impact it's having on in terms of the rollout, but also transmission. That feels positive in terms of the feedback we're getting. But you then got to work out how you take the steps in the right sequence that are responsible. I don't think there's a high risk in relation to schools of children getting it, or indeed even teachers and teaching staff. The risk is the transmission into household that comes from it. And on that, we've just got to look at the evidence. So, which is why, as much as I'm sure, I've been doing interviews this morning, people want to drag you into giving more precision on the plans. We do need to wait and make sure we've got the data so that we can set it all out responsibly. But we want schools open, primary and secondary, just as soon as we possibly can.
Okay, well, I have to say, from your words, although you haven't committed to this, obviously, it does sound like the CRG might get their way on that one. Another one that they've asked for is pubs and restaurants to be open by Easter. Now, Easter's early this year. It comes on April the 2nd. That's Good Friday anyway. They're saying in a COVID-secure way, but that does feel quite close to me. Just 5-6 weeks' time to have all pubs open, albeit in the back garden. Should they temper their expectations on that one?
Well, I think, as you point out, it's difficult to say with any reliability where we'll be within such a relatively short space of time. But what I can tell you is that schools is the priority. As on top of that, in terms of business, non-essential retail, and then after that, I suppose, given the wider risks of transmission, of course, we want to get hospitality open. But the truth is, it needs to be evidence-driven. Our plan is, as you know, to hit that target tomorrow, 15 million highest 4 groups, the 4 groups of highest risk people, and then by the end of April to have got another 17 million people with the first doses. At that point, the significance is we hope that 99% of those most at risk of dying of the virus will have had that first dose. So we can, from that point onwards, hopefully charter an even more ambitious path forward. But you've got to see how the vaccine rollout works and gauge what the impact it has on the virus, including the variations to the virus, which is why it's difficult to set out in precision with sort of cast iron guarantee what the plans will be around in the way that some of my colleagues wish us to.
I totally understand. And there is an awful lot of quite excitable reporting around today and over the last few days about what's going to happen when. So that's not your fault. That's what newspapers do. And it's all right and good that happens. But it would be helpful to temper some expectations, especially around Easter. As you're aware, families have been apart for an awful long time now. And Easter has been a point that some have been looking forward to getting together. And I think that's possibly why everyone wants pubs to reopen, at least so they can go for Easter Sunday lunch or something. But are you able to temper those expectations, or should people expect to be able to get together with their families on Easter?
I can't set those plans out as I've already explained. What we're going to do is gauge and accumulate the full evidence that we've got to date based on the vaccine rollout, what it's doing. We can see, if you look at the Friday data, the 7-day totals for the number of cases, hospital admissions and deaths is down by anywhere between a fifth to a quarter, depending on your indicator. That's good news, but we need to set out the full details and assess the impact on the variations. The PM will do that on Monday week, the 22nd of February, and it's at that point that he's going to set out some more detail on the plans forward. But what I can tell you is that the priority is schools, but also we want to look as soon after that as possible at the position of non-essential retail.
I think you've been quite clear that the hospitality almost certainly won't be in that first sort of couple of waves of reopenings. But is it helpful, to put it another way, that you've got 63 very belligerent Tory MPs now setting out public demands, setting out public timetables of when they think certain things should happen? Is that helpful for you as a government? Is that helpful for people's expectations, which do need to be managed?
I think people understand that MPs are there to scrutinise the government. We share the restlessness to get things moving, to get things opened up. We obviously want to make sure it can be done in a safe and responsible way. I don't have a problem with anyone that wants to make specific suggestions. Ultimately, as the government, we've got to take the decisions, and that's what we're doing. I also think that the way we're approaching this, hitting the first milestone, I'm confident we'll do tomorrow on the vaccine rollout, then planning for the second one by the end of April, and then all adults to get a first dose by the end of September. And as we go, very carefully assessing what impact that has, that must be the right way to go. You can't have your proposals based on anything other than the evidence, and that evidence is collated in real time.
Okay, you can't say what's going to happen when, I get that. But can you say a little bit about how the roadmap will work in terms of, will there be numeric targets included in the roadmap to trigger the next stages on? For example, once we get down to a certain level of hospitalizations or a certain level of transmissions, then we can go to the next level. That's evidence-led, isn't it?
Well, so I think the reality is that there are certainly targets for getting things like the R rate down. So having the R rate below 1 is critically important, because then you're winning the battle over transmission. I think also you need to have some targets to make sure that the NHS and the hospital beds aren't being overwhelmed. But there's also, at the end of all of this, a judgment call. So it's part art and part science, if you like. And I think the scientists have always, certainly in my conversations, been quite clear about this. The evidence doesn't, there's no magic formula that you can just plug in the data to. And you've got to, as we've said right the way throughout, balance, if you like, 4 things: the COVID impact, the non-COVID health impacts, and then the economic and the social impacts. And there's no answer other than to balance those different factors as we chart a course forward.
Okay. Can I just, final question on Unlock, then we'll move on. But I think it's fair to presume, isn't it, that this will be the last lockdown. The government simply won't put in force another lockdown, or, as the Prime Minister say, go into a reverse ferret. Because, and you can say that comfortably now, because if you can't say that, you're effectively admitting you reserve the right to botch this one as well.
And I think we've always got to measure the evidence of the impact of the measures that we're taking. But look, the whole point of the vaccine rollout, coupled with testing and tracing, plus also the thing we haven't talked about, the impact of therapeutics, drugs that take the fatality out of the virus, is to mean that we move into a whole different place, which will not need us to engage in any further national lockdowns. And so I think it's very unlikely, if we're successful with the vaccine rollout, that would be necessary.
Very unlikely, but not a hard promise.
One thing that we've learned, if you look at the last year or so of this pandemic, is you make these guarantees, and journalists perfectly reasonably ask for them, but you have to constantly adjust. And for example, with the variants, now everyone knew that the variants come with any virus, but quite the impact they have on the measures you've got to take is something which you can only assess in real time with the evidence. So that's why it's difficult to set out 6 months from now with precision quite where we'll be at. But what I can say is that we're optimistic. I'm cautiously optimistic in the way the PM described, because of the success of the vaccine rollout, and because of the evidence we've got so far, and it's still only early days, of what it's doing to the virus.
Okay, let's talk about those vaccinations. 14.6 million jabs done as of yesterday, many more going on today. A phenomenal rate, an incredible success. The NHS in England certainly announcing that it's moving on to vaccinating at-risk groups 5 and 6 tomorrow. That's people aged 65 to 69 and those with underlying health conditions. But as that happens, do you know how many people in groups 1 to 4 have yet not been vaccinated? Either they haven't been offered or possibly more likely they've refused that offer.
I don't have that data, but of course the roadmap has always been explicit that it's 15 million people in the highest priority groups offered the vaccine. And obviously we are sending out a very clear message. People should have the vaccine if, for example, practical reasons or some people have missed out. We then go back, we track back and make sure that they're still being offered it. And when we can get that slot in so that they can come and have it. In the last analysis, if people ultimately refuse to have it, we're not forcing them. We're not coercively saying you must have this vaccine.
Understood.
What we are saying is that people should. It's the responsible thing to do for themselves and their friends and their loved ones.
What I suppose I'm asking is, do you record who has said no thank you to a vaccine offer? Do you know who they are?
I think we certainly track who's had the vaccine and therefore you can then cross-reference that to the target list that you've got.
So you do know who's refused it, and you could possibly go back and ask them, perhaps they'd like to reconsider, because it's a pretty important thing.
Absolutely. And I think that's important that we track back over those who may, for one reason or another, not have taken up the first offer and try and encourage, coax, cajole, make sure that it's practical and possible for them to get that vaccine. We want everyone vaccinated.
Okay. It has been reported, we know that there's a deficit in the BAME community take-up of the vaccine, and that's alarming. The government are trying to address that. But it has also been said, anecdotally, some MPs now talking about this, that the lower down the socioeconomic groups, if you like, that the less disadvantaged you are, the less the vaccine take-up also is. Is that something you're aware of?
Did you mean the more disadvantaged you are, the less
more
the
disadvantaged you are, the less vaccine the take-up is exactly?
So I've heard reports of that. We're obviously very conscious of the take-up across different BAME communities across the UK. We're focused on, as I said, making sure everyone has the vaccine. And what I think is important is that we tailor our communications and make sure people representing those communities stand up and join with me and the political leaders in saying, come on, we've got to get this done. It's important. It's safe. The WHO has been very clear on that. All these vaccines that we're rolling out have been properly tested through the regulatory system, and it's the right thing to do, not just for your health, but for those around you, and not just your family, but your community.
Okay, but there's no empirical measure yet on socioeconomic groups and vaccine take-up.
So I've heard anecdotal reporting of it. I haven't seen the hard evidence on it, but it's something that we of course want to track carefully.
Okay. Finally, maybe not just on coronavirus per se, an interesting development this week from the US. America's Center for Disease Control and Prevention, the group running their pandemic response, issued new guidance this week to recommend the wearing of 2 masks, one surgical one and then a cloth one over the top of it as a way to improve your mask fit. And apparently that reduces your exposure to aerosol by 95%. Is that something the UK government will look at?
Well, I don't know specifically that example, but the truth is the system that we've got in place means that we don't just track the virus around the world. We also look at the measures that are being taken and see, well, okay, let's check. Do we think that's a smart thing for us to do? And SAGE and the scientists and the policymakers feed back into the government, all of that kind of thing. So we make sure that we're learning from the best practice around the world. But whether or not that we're going to receive advice on that, I don't know.
It's not something you've talked about so far, 2 masks?
No, it's not something that's certainly crossed my radar.
Okay. You're announcing this morning that the Prime Minister will host a virtual meeting of the G7's world leaders on Friday, in which he'll call for further international cooperation on vaccine distribution, an admirable aim. But would that be a good moment for the government to say whether it will share any of its own very impressive supply of vaccine stocks before our entire adult population is vaccinated first? So we know what you're doing, we know what you committed to Gavi, etc. But what about, and where is your position now on whether you'll vaccinate all adults in the UK first before you share with the rest of the world?
Well, we've got to make sure that we protect the integrity of our domestic rollout. And the issue is quite how many and when we would be able to release any surplus. But we are, of course, looking and thinking about, with the surplus, once we know what it is and when it will be available by, how we aim it and where we provide it. And what I can tell you is that the leading call on it will be via COVAX AMC, which is the international mechanism to make sure the poorest countries, the most vulnerable countries, get equitable access to the vaccines. And we have already provided £500 million, which secures 1 billion doses for that mechanism. And what the Prime Minister is doing with the virtual meeting of G7 leaders is saying, look, we're leading by example. We're already demonstrating that we're committed to this, and using his convening power to get other leading presidents and prime ministers around the world to follow the British lead. And that's the way we'll get a global solution to what clearly is a global problem.
Foreign Secretary, good morning.
Morning.
Could I just take you back to the formula for releasing instructions? You talked about vaccinations a lot, and clearly vaccinating the top 9 groups is crucial. I wanted to just ask you about the infection rate. You mentioned the R rate, but I'm talking about the cases per 100,000. For example, last summer, you closed travel corridors when any country arrived at 20 cases per 100,000. Is that a useful figure, or have we learnt more since last summer?
Well, so we have learned a lot more since last summer, but of course it's not just the rate of infection or the prevalence in the countries concerned. It's also the similar indicators in the UK, because the impact of border measures, if there are relatively low levels abroad but high levels in the UK, is much less significant. The issue really now, which is different, is that we're trying to guard against variants to the virus coming in through the back door and either receding in the UK or, worse still, undermining the vaccine. So the border measures are a part of that, which is why we're taking the extra measures, the additional measures with the quarantine hotels tomorrow.
Sorry, just to make clear, I'm really interested in the domestic answer. So, for example, some towns went back into pretty much lockdown when the infection rate was 25, 30 per 100,000. Was that a useful set of data figures?
Yes, of course it was at the time, but we use our best evidence, and the situation is different now because we're combining a different set of data on what we know is what's happening in the UK and abroad. We're at different stages of the cycle of the pandemic, and crucially, the variants to the virus are the key, if you like, risk that we're now trying to cater against. So we're just not in the same situation, but of course, we're looking at those measures and additional ones.
Okay, Mr. Raab, I think our time is pretty much up, but it wouldn't be fair to let you go without asking you what has happened to Mrs. Raab on Valentine's Day. I've managed to get Gloria nuts. That's the extent of my achievements. Have you done any better?
My wife did reasonably well out of Valentine's Day. I cooked dinner, and a suite of presents was presented.
A suite?
A range.
You've done better than me. Mr. Raab, thank you very much for joining us on G&T this morning.